Hello.
पीछे बस उधर साइड में
Good morning, namaste, and welcome to Times Health Plus. Today, I, Dr. Sneha Rathi, I am a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga and get the best results for my patients through them. So today what we are going to do is, we had missed on a few parts last time because of some technical glitches. So we are going to continue on that, whatever we missed. And I'm also going to summarize onto what exactly we did last time. So we covered 5 things last time, okay? So the first one was, what is a limp? okay, and how to manage a limp. The second one was stair climbing, ascending the stairs and descending, coming down the stairs. The third one is squats, which we are yet to cover. The fourth one is how people get up from the floor. What are the different ways of getting up from the floor? And the fifth one is how to bend forward. After that, we are going to look into what are the functional mobility drills. Okay, so we're going to look into 5-minute functional mobility drills. And then what we are going to do is we are going to look at some asanas which are going to help you in all these activities. So let me just summarize. I hope last time you had heard what all I had spoken about the limp. Let me just quickly summarize it for you. Okay, before that, you can write down if you remember anything that we talked about the limp. Okay, so just tell me what is a limp and how did we manage it? Okay, you can write it in the comment box if you remember whatever we discussed last time. I'm going to summarize it very shortly. Okay, so what was a limp? A limp, did you remember how a person with limp walks? Okay, so a person with limp generally does not completely weight bear on the extremity that is hurting. Okay, so there is pain in the lower extremity. So a person who is having a limp won't bear complete weight on that extremity and would try to quickly shift his weight to the normal extremity. Okay, so he would be walking with less weight on the painful extremity. So if my right is painful, what I would do is I would put less weight on the right lower extremity and quickly try to transfer the weight on the left one. Okay, but what happens with this is if you continuously keep on limping and don't correct that posture, then what happens is slowly and steadily you will notice that the pain which is there on this side might actually get transferred to the other side as well, which is not a very good thing, right? So you understand what is the importance of handling the limp really early. In the early stages, as soon as you start observing that you have developed a limping attitude, okay, you need to address it right away. Okay, so for that we need to understand what are the causes of a limp. So the causes of a limp are different. First is there can be pain in any of the joints of the lower extremity. It can be the ankle, it could be the knee, or it could be the hip. Okay, so that can cause a limp. Second, there could be any kind of injury, or when you are recovering from the injury, if you are hurrying for the process of recovery, then also you can develop a limp while walking. The third one is if there is any neurological condition wherein there is a lot of muscle weakness, or because of the muscle weakness, the person is developing pain, then also there could be a limp. The fourth one is if there is an overuse injury. So if your muscles are getting overused, then also there could be a limp. So these are the variety of causes of a limp. And how do we manage it? So I'm going to quickly, in short, summarize what we discussed last time. So the first one is you need to use icing to reduce the pain. Okay, so you can use icing if the pain, because in limp generally the pain is very acute. So to subside the inflammation and pain, you can use icing. Okay, the second one is that you need to consult an expert. Okay, so a physiotherapist or an orthopedic doctor, you need to consult them so that they can find out the root cause of the pain and solve it there. So that is very, very important to correct the limp. The third one that needs to be done is you need to wear a protective bracing. You might have heard of a knee cap or a knee brace, okay, something like that. So if the ankle is problem, you wear an ankle brace. If the knee is problem, you wear a knee brace. Why is it helpful? Because it supports the joint. Just like the muscles support the joint, the same way the brace actually supports the joint, and that's why it reduces the strain on the joint and it can thus reduce the pain. If the pain is reduced, automatically the limping will get reduced. The fourth one is you need to have good footwear, a sturdy footwear, which actually gives you a lot of shock absorption. Okay, so when we walk, there is a ground reaction force that comes onto our joint. That shock absorption can be done with the help of a good footwear. So a good footwear is the next thing. After that, you need to do certain exercises to relieve the pain and to strengthen the muscles. Okay, so that is very, very important that you figure out what exercises need to be done to relieve the pain and to strengthen the muscles so that they support your joint. Okay, And the next one is you also need adequate relaxation or rest. Okay, so rest when you can. So make sure that you give adequate relaxation or rest to the joint so that it can actually work towards recovery and the inflammation and pain can be subsided. Okay, so these were the few points which I had told you, discussed with you last time. You can also use a walking aid in case if the limp is too chronic and it's not getting managed. So then you need to use a walking aid or a stick so that the entire load doesn't come onto the joint and it is shared with the help of a stick. There should be no embarrassment in using such kind of a stick in case if you are suffering from pain for a long time, because it is required, otherwise the joint keeps getting strained and the condition whatever you are suffering from may progress further. So it is very important to manage the limp as soon as it develops. All right, so this was the first thing that we had discussed last time. The second thing that we had discussed last time was stair climbing. Okay, so now what were the points that we discussed last time for stair climbing? Do you remember any of the points that we discussed last time? Okay, so we are going to just quickly go through that. So I'm sure everybody of us might be climbing stairs on a regular basis, climbing as well as going down on a regular basis. Okay, so what do? When we keep our foot on the staircase, it's very important that you keep your entire foot on the staircase and not just a part of it. So what happens is most of the times when we are climbing stairs, okay, what happens is we quickly try to climb up. Okay, in that process, we just end up keeping half the foot on the staircase. That can lead to a lot of strain on the calf muscles, okay, also on the knees. So it is always advisable to do not do tiptoeing on the staircase. Instead, keep the entire foot on the staircase. Okay, so this is the first point. You might notice it when you start climbing stairs, whether you are keeping the entire foot or you are just keeping a part of it. Okay, so just try to notice that and correct yourself. If at all you're just keeping a part of it, try to keep the entire foot on the staircase whenever you're climbing up. Okay, the next thing that is very important while climbing stairs is that you bend your knee adequately, okay, and then make sure that the knee is not falling inwards or outwards. Okay, so whenever you're climbing the stairs, you are not straining the knee in this direction or this direction, but it is more so pointing the front. Okay, so that is very, very important. This is also important while descending the stairs. Okay, so this was the second thing. The third thing that is very, very important is you can lean a little bit forward while climbing stairs, but make sure you're not leaning too much forward. Okay, so if you're leaning too much forward, it just indicates that there is some lack of strength in the lower limbs and that needs to be tackled. Okay, so what do? You can lean a little forward while climbing the stairs, but not too much of forward lean is advisable. The fourth thing that you need to do is whenever you keep your foot on the next staircase, make sure you're activating your glutes and your hamstring muscles. Okay, so these muscles are very, very important while climbing up the stairs. So what do? You place your foot on the next stair and then you make sure that you press adequately on the foot and then climb up the staircase, next staircase. Okay, so you are activating your glutes and hamstrings. If you pay good amount of attention, you will also be able to notice that there is activation of these muscles. Okay, so make sure you do a little bit of conscious stair climbing. The next thing that is very, very important in stair climbing is that you keep your chest up and core engaged. Okay, so if there is lack of core engagement, mostly people climb up stairs with a forward lean. That particularly indicates that the core is not engaged well. So make sure that your chest is up, your shoulders are erect, and then you are climbing up the stairs. You can use a handrail if required, if some people have a less of lower extremity strength. Okay, so in that case, you can use a handrail if required and try to climb up stair properly. Okay. All right, so these were some of the points while climbing up the stairs. Jagdeepji says my foot size is 11. Okay, so should I keep my foot inclined to get whole foot on the stair? No, you do not have to keep your foot turned outside or turned inside. You have to keep it straight. So in your case, how much ever you can keep the foot properly on the staircase, make sure you keep your foot that much, as much as it fits the staircase width. Okay, so there may be different width of the staircases. You might keep your foot as much as possible on the staircase. Okay, so tiptoeing should always be avoided because many people keep almost half of the foot outside the staircase. Okay, that is not advisable. That can actually lead to a lot of soreness in the calf, and people might experience calf pain or knee pain after they have climbed the stairs. Okay, so that's about it. Next, what we are going to do is now we are going to discuss how to descend the stairs. So I'm going to quickly summarize. I'm going a little fast on this because we have discussed last time. You can also refer to the video, last time video for the same. Okay, so next is stair descending. How do you go down the stairs? Okay, so what is very important while going down the stairs is the control of your leg. Okay, so what happens is when we keep the foot down on the next stair, we are actually controlling the movement of this leg so that we can step onto the lower step. All right, so now what is supposed to be done is you are supposed to make sure that you have got a good control while lowering the leg. Good control on the extremity that is there behind. Okay, so you need to have a good control of that. That is the first point. The second point that is very important again is your knee should not be caving outward or inward while going down. Okay, so when I'm bending the knee, okay, make sure that it's not going this way or it's not going this way. Okay, it should go straight forward. All right, so that is the next point that you need to make sure while you are descending the staircase. Again, it's very important that you are not too much leaned behind or you are not too much leaned forward, but most of the times you are erect while descending the stairs. Okay, so that is the next point that you need to remember. Do not lean too much behind. So many people tend to lean too much behind to maintain their balance, okay, or lean too much forward. That is not recommended. I have seen many people doing this while descending the stairs. They tend to turn their body and then descend the stairs because they do not have adequate control of the knee flexion over here. Okay, since this movement is not adequate, so that's why they turn their body and then get down. It's a good compensatory way to get down the stairs, but if you train your body to get that movement right, okay, this movement right, you might be able to do the stair descending much better than what you do when you do this. Okay, so this should be avoided in most of the cases because it causes a lot of instability at the knee with this kind of motion while descending the stairs. Okay, it's okay to use a handrail, okay, to get down the stairs, because if you take adequate support, you might be able to control the movement much better. And the next thing is when you're keeping the foot down on the next staircase, okay, generally what happens is we do not keep the foot down like that. You keep the ball of the foot, this part of the foot down first, and then you lower the leg down. That's the natural way of doing the stair descending. Okay, so make sure you keep the ball of the foot first and then lower your heel down, and do not get down directly with the stamp of the foot. That's not quite good because it will cause a lot of strain directly on the knee, while this is a little more shock absorbing movement, so it is much better while you descend the staircase. Okay, so these were some of the points that we covered last time, and I'm repeating this time so that you remember how to ascend and descend the stairs. Now, there's a small tip that you can use in case you're suffering from any kind of pain or any kind of injury. While going up the stairs, you can always use the good leg first. So if your left leg is injured, okay, use the right leg to ascend the stairs. So climbing the stairs with the right leg, with the normal leg. And while descending the stairs, while coming down, you use the bad leg first. So if your left leg is injured, what you do, you keep the left first and then the right. You keep the left first and then the right. Okay, so this is a small tip. If in case one of the knees or one of the legs is injured, you can always do a climbing up and going down accordingly. Besides that, what you can do is stairs can be used for a lot of cardiac muscle training. So when you are climbing at a normal speed, you can intermittently increase your speed of climbing the stairs. Okay, that can be used as a type of cardiac or aerobic training. Okay, so it's a very good way to train the aerobic. So intermittently increasing your speed while climbing or descending the stairs. That is very good. Next, what you can use the stairs for is strengthening. Okay, so if you skip one stair, okay, you skip one stair and directly place it on the alternate stair and then climb it, that's like quite a good amount of muscle strength is required to do that. Okay, so you can always use this two-step theory. So skip one step, directly place your leg on the alternate step and try to climb up. That is going to strengthen your legs a lot. So this is another way to strengthen the legs. Alternatively, you can also do some exercises on the stairs, like you can be on the edge of the stairs and you can do calf raises on the stairs. You can do lunges on the stairs. So you can keep one leg on the staircase, one leg on the floor, and then you can just go down with the lunges. So these all exercises you can do with the staircase. Okay, so this is how important staircase climbing and descending is. And I hope most of you are doing it on a regular basis. Okay, so this was about stair climbing and descending. Now let's go on to the next thing, that is squats. Very, very important. Okay, last time we had some technical glitches, so maybe most of you must have not seen the squat properly. Okay, so I'm going to repeat the entire thing again. What is squat required for? Okay, so squat is required for many activities which we do in our daily life. For example, if you want to get up from the floor, you need to have a good squatting mechanics. Okay, if you want to sit on a chair, okay, that also needs a good squatting mechanics. Okay, so such trivial things that we do in our daily life, okay, squatting is so important in that. All right, so what we are going to do is we are going to understand or analyze what a good squat mechanics means. Okay, so the first thing first, you need to keep a 1 foot distance between your feet while squatting, or you can keep a shoulder width distance between your feet while squatting. Okay, so that is the first point that you need to take care, a 1 foot distance between your feet. Okay, so the next thing that is very when you squat, okay, you make sure that you are again not leaning too much forward. So I have seen many people, they tend to do this kind of a squat. Okay, so this kind of a squat can actually cause a lot of strain on the knee as well as the lower back. Okay, so this is very important that you do not go like that for a squat. Okay, if you are doing this, it just suggests that either your core strength is not enough or you have less strength in the lower limbs. So what do? What you have to do in this case is you only go down as much as you can keep your back straight. Do not go down beyond that. Okay, first train your knees and legs to take the weight with a straight back. Okay, so that way you can train your body to not do this in the squat. Another way to train it is just to give you a feedback of whether you are squatting right or no. What you can do is you can go towards the wall. You can touch your back to the wall so that your back is erect. Keep your legs a little forward and then slowly go down and come up. Okay, go down like that and come up. Okay, so this is a good way to train your body to keep the back straight and then squat down. Okay, here you're getting a feedback from the wall whether you are leaning forward or no. So this is a good way to train your body. The next thing that is very important while doing the squat is that you do not take the knees inwards or outwards like that. Okay, the thighs should be parallel to each other while squatting. Okay, so you're not caving the knees inwards, that's wrong. You're not caving the knees outwards also, that's also not correct. You're keeping it straight, pointing ahead, and thighs are parallel to each other. It's okay to cross the ankle, that's natural actually. So it's going to happen, but make sure that you are not turning the knees outside or you're not taking it inwards. Okay. Now, the next one that is very important, next point that is very, very important is that while going down, you're not pointing your knees downwards. Okay, so your knees are facing forward and not downwards. If your knees are pointing downwards while going down, it again indicates that there is some weakness in the glutes, core, okay, or your knees. So you need to work on that first and then go for squatting. So make sure that your knees are pointing forward. Now go down till the level as much as you feel you have the control. Okay, so if you suppose you do not have control beyond this, do not try to push yourself down beyond that. Okay, because that can cause a lot of injury to the joints. So make sure that you are going down only as much as you have the control. Okay, so that's the next thing that is very, very important, because I have seen people forcing themselves to go down and they do not have the control, and then getting up becomes very difficult, and then it is very strenuous on the joint. So learn to identify what is the comfort level of your body and learn to do it again properly. Okay, okay. Can you hear me? I hope you can see me. So learn to go down as much as you have the control at the leg joints or the thigh and the knee joints. All right, so that's the next thing that is very, very important. Okay, so these were some of the points that you need to take care while squatting down. It's the best to train your squats with the help of the wall support. So the one that I showed you, okay, so what you do is you keep your legs forward, you keep your back touched to the wall, head straight, okay, hips also are touched to the wall, and then you go down and then you come up again. All right, so this is the way you can train your squats in the initial phase. Then what you can do is you can go against the wall, don't touch your back to the wall, and train yourself to go down like that. Okay? And now, to add on to the challenge, what you can do is you can raise your hands up so that you have to keep your back straight, and then you go down and then you come up. You go down and you come up. Okay, so this kind of challenges can be added while doing the squat. To add more challenge, you can hold a weight in your hands and then try to do the squats. Okay, you can also hold a weight overhead and then try to do the squats. Okay, so these are the different ways how you can challenge your squats. So this was all about squats. Okay, next what we are going to look into is what are the different ways of getting up from the floor. Okay, so how people get up from the floor. Is there a right way or a wrong way?
Speed check at least. फील अच्छा है
Okay, so okay, Rahulji says I drive a car and get knee pain after drive of 30 to 45 minutes. Not sure if my driving posture is correct. Looking to know which exercise should I do to overcome this pain getting due to driving. Okay, so has been a session wherein we have looked into what knee exercises you need to do, or the knee and ankle strengthening, how to strengthen the knee and the ankle. Please try to look into it and get an idea of what exactly you can do for the same. Okay, so the next thing that is I'm going to cover is how people get up from the floor. Okay, so what we are going to do is, the first technique that people usually use is, so when we are sitting on the floor. Okay, so I'm sitting on the floor. Now what we are going to do is, people generally what they do is they go into quadruped position like this. Okay, and then what they do is they keep one leg forward, lunge position, and then they tend to get up. Video is still frozen, they're saying. Correct, that's, I understand it's important for you to see. Okay, so I'm going to repeat this again. What we are discussing is how people get up from the floor. Okay, so generally what we do is We sit down on the floor. Okay. Then they go into quadruped position like this. Then keep one leg forward, put weight on the leg, and then get up from the floor. So this is one way of getting up from the floor. Here you can take support of some surface also, like a wall or a chair or some kind of support which is required while getting up. So again, I'm demonstrating it. Video is still frozen. Okay, can you see me? Can you see me moving now? Or is it still frozen? Okay now? Okay, perfect. Great. All right. So now we are going to see how to get up from the floor. In case if you see, we are trying to work on the blurriness part. Okay. So in case if you find again any kind of glitch, please let me know. Okay. So now I'm just going to demonstrate to you how to get up from the floor. Okay. So sitting on the floor. Okay. You go on to your quadruped position. So you go like that. You keep one leg forward, put weight on that leg and get up. In this kind of position, you can use some chair or some surface, okay, to support yourself while getting up. Okay, so I'm doing it once again. You sit down on the floor, go on to quadruped, keep one leg forward and get up again. Okay, Roshni ji noted, Madan ji noted, Jagdeep ji noted, Nidhi ji noted. Okay, the video is frozen, I get it. Okay, all right, I'm continuing now again. So once again, I'll demonstrate to you how to get up from the floor. Okay, so you sit on the floor. Yes, okay, I'll quickly get up before it freezes again. So you sit on the floor, you go into quadruped, keep one leg forward, okay, put weight on that leg and then get up. Okay, so make sure that the chair, again frozen. So there is some technological problem, I think. Rahul ji, I'm going to show actually different ways of getting up from the floor. So actually you need to see what I'm doing so that you can understand it better. Okay, it's coming and going, I think, in between. Okay, so this was the first way of getting up from the floor. The second way is people go into, suppose if you are sitting on the floor, and then what you do is you go onto a side sitting position. So you flex both your knees, go on to kneeling position like that. Okay, put one leg forward and then get up from the floor. Okay, so this is the second way of getting up from the floor. Once again, you sit on the floor, go into the kneeling position, keep one leg forward, get up from the floor. Okay, so this is the second way of getting up from the floor. The third way of getting up from the floor is wherein this requires a lot of core strength and lower extremity strength as well as mobility. So this can be used in people who are young. Okay, so you go sit up like that. Okay, and then turn your legs in and then get up from the floor. Okay, Roshni ji, we'll see from the recording, can't see anything. Okay. As soon as I sit down, I think it freezes. So you're not able to see how I'm getting up. Okay, Nidhi ji, I have noted that down. You're not able to see any sitting suggestion. Okay, no worries. I'm going to definitely get across this information to you. Okay, but we just have to wait for the, I think, this glitch to get corrected. Jagdeep ji, we can hear, but difficult to imagine and follow only with instruction. Yeah, I understand that, Jagdeep ji. Okay, Gigi, I think it's okay now. All right. We are just checking on the technical problem. So please, if you can stay, it would be great. Still, you can just hear my audio, is it? Or you can see me moving? Yes, now you can see me moving. Perfect, perfect. Okay. Okay, all right. So I'm just going to do that again for you. Okay, so I'm going to show you 4 ways of getting up from the floor. No, it's frozen again. Okay, okay. All right, all right. I can understand. So please stay if you are okay to stay. We are checking on the technical issues. Okay, Nidhi ji, noted. I have noted down. It's freezing again and again. I understand. I think they should end. Dr. KTG, yes, I'm going to repeat it definitely. I am definitely going to get all this information across. Kaveri ji, yes, I know every Sunday this is happening. We are looking into the problem. Why is it happening exactly? Shankar ji noted, I'll repeat this next week, definitely. Yes, Kaveri ji noted, I'll repeat this again. Yes, Jagdeep ji noted. I understand. And I also understand you need to see me while I am doing the different movements. So I'll make sure that I repeat all of this again. Rahul ji, thank you for understanding. And thank you for staying back. Neeluji noted. I will repeat this session again. I think most of my things has a lot of alignment and other things. So I need to show you the movements in order to get the information across you. So most of my things require alignment, muscle work. All of these topics are there in my thing. So I think you will have to see whatever I'm talking, because next I'm going to show you some functional movements. So that also needs to be seen. Only then you will be able to understand it better. So I think we need an uninterrupted video so that I can get the information across. I would like to thank all of you for staying back for so long with patience and understanding the problem. I'll end it. Yeah, I understand, Jagdeep ji. It freezes again. So I'll try to demonstrate the things again, getting up from the floor. Okay. So let's hope that it does not freeze again. Yes, I'm moving backward and forward. That's what I have been doing. Okay. So we were discussing about the 4 types of getting up from the floor. Okay. So the first one is sitting down, going on quadruped position, taking one leg forward and getting up from the floor. No, it's frozen again. No video. Okay. So sitting down on the floor, going into quadruped, keeping one leg forward, getting up from the floor. This is the first way. The second way, sitting on the floor, going into side sitting, coming up on your knees, kneeling position, keeping one leg forward and getting up from the floor. Thank you, Jagdeep ji and Rahul ji, for updating. Okay, once again, Sitting on the floor, going into side sitting, coming on your knees, one leg forward, getting up from the floor. This is the second way of getting up from the floor. So first one demonstrating again in case if it was frozen, going on quadruped, keeping one leg forward, getting up from the floor. Okay, so this was the first way of getting up from the floor. The next one that we are going to look into is where people have good core strength and leg strength. So sitting up like that, okay, crossing the legs and then getting up from the floor. It's frozen again, okay. Okay, you could see only the first one. All right. एंड कर दूं क्या मैं? Okay, I could see the second one first. Third screen got frozen. Okay, all right. I'm going to demonstrate that again. Don't worry. Pushpa ji, picture is also not clear. Okay. I think
Sorry. Cut this. WhatsApp is there local? नहीं. It's wrong. बंद कर. Mouse आ रहा है. तो
Nidhi ji, I'm actually at the same place where Vinay ji also takes the sessions. So the place is the same, all the setup is the same. I think there is some other technical issue, maybe from the streaming platform or something. Okay, can you see me now? Now it's much clearer? Okay, perfect. Okay, great. Pushpa ji, thank you so much for waiting. I'm just going to quickly demonstrate the 4 techniques and then we will wind up the session. Yes, so just the 4 techniques of getting up and then we'll wind up the session and we'll take the functional movements next time. Okay, so the 4 ways of getting up from the floor. The first one is you sit on the floor, you go into quadruped position like that, you keep one leg forward, you can take support of something, okay, like a chair or some support or a wall, and then you get up from the floor. So this is the first way. Okay, sitting on the floor, going into quadruped, 1 foot ahead like a lunge and getting up from the floor. So this is the first way. The second way is you go into sitting position, go into side sitting position, kneeling, 1 leg forward and getting up from the floor. Okay, so this is another way to get up. Once again, I'm showing it to you. Go into sitting, side sitting, kneeling, 1 leg forward and get up from the floor. Okay, so this is the second way. The third way is you sit up like that. Okay, cross your legs, put weight on your legs and get up from the floor. But this requires a lot of knee mobility, core strength, leg strength. Okay, that's very, very important in this kind of pose. So here again, you sit up like that, cross your legs, take support and get up from the floor. Okay, so this is the third way. And the fourth way is specifically for the people who do not have enough knee mobility. Okay, so what happens with them is that they do not have enough knee bending. Okay, so the third one, yes, I'm going to repeat it again, Nidhi ji. So I'll just show you this one and then I come back to the third one. So here they do not have enough knee bending. So what do? They kind of go into a plank position, drag their hands back and then get up from the floor because they cannot bend their knees adequately. So this is the way they get up from the floor. But over here, your arm strength and your back flexibility has to be good enough to get up from the floor. So I'm demonstrating the fourth one once again. Your knee mobility is not enough, so you cannot bend your knees enough. So go into plank, go up and like that. Okay, so this is the fourth way. The third way, repeating again, Nidhi ji. So you go into, from this sitting or whatever way you are sitting, you go into straight sitting position, cross your legs, put your weight on your legs and then get up. But as I mentioned earlier, it requires a lot of knee mobility as well as strength for doing this kind of getting up. So these are 4 different ways of getting up. Here you can take support of different, like a table or a chair. You can take support of a wall, okay, to get up. So different ways you can take support and you can get up. Okay, so these were 4 different ways of getting up from the floor. Okay, now just to quickly define some functional movements. Okay, so I'm going to give you 4 or 5 functional movements so that you can practice it at home. So the first functional movement is calf raises. Okay, so how do you do calf raises? I guess everybody of you know that. Okay, so this is calf raises. You can take support of the wall and do it. Okay, so this is calf raises. First one. The second one is squats. So again, as I showed you the correct mechanics of squats. So you take a 1 foot distance, go down and come up. 1, 2, 3, 4, and 5. The third one is lunges. So you keep about 3.5 foot distance between your feet. Bend your knee and go down. 1, 2, like that. 3, 4, 5. Okay, repeat it on the other side. 1, 2, 3, 4, 5. So these were lunges, okay? And the next one is you can go for a wall push-up, okay? So what you do is you move towards the wall, keep about a 1 hand distance from the wall, and then slowly lean towards the wall and push yourself up, okay? You lean towards the wall and push yourself up. Lean towards the wall and push yourself up. So a direct push-up may be a little difficult, but this kind of push-up becomes very easy. Okay, so you can practice this push-up initially. So these were some of the functional movements that you can practice on a regular basis. I would like to give you a challenge. You can do these functional movements for 5 minutes in your day, anytime. Click a picture or take a video of it and upload it on Instagram. Also, make sure you follow TimesHealth Plus on Instagram as well as YouTube for further tips and techniques. Okay, so I'm sorry for the technical glitch this time as well. Okay, but I'll see you next time with some more information on this. Thank you for keeping the patience and staying back. Okay, so I'll see you next time again. Till then, stay present, move gently, and make sure you take care of yourself. Thank you and namaste.